Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today is the second Saturday of the month, which means it's time for Moving Medicine Forward with Dr. Michael Klaper and Dr. Zach Burns. And today they're going to be discussing whether or not ChatGPT knows more about dietary disease reversal than your doctor. Please welcome them back to the show. Hi, Dr. Klaper. Hi, Dr. Burns. How are you both today?
Great.
Oh, we're just great. Hi, AJ. Great to see you and great to be with all your viewers today. Thanks for the invitation, as always.
And Dr. Burns, how are you? I just noticed you're going to be speaking at the Plantrician Conference in September.
Yes, I was very excited about that. It'll be my first time there at Plantrician, and I'm going to be talking about medical training. At that point, I'll be just a few months out of residency, and so I'll be able to give people a timely perspective on how we're being trained. There's some good things and some possibly deficient things when it comes to nutrition.
That's exciting. Is this like your first major talk?
You could say it. Yeah. Well, I mean, being on Chef AJ is, that's
But you know,
pretty major.
they get about 600 people to that event.
Good.
It
Yeah,
should be a good one. Yeah, looking forward to it.
nice. Well, you know, ChatGPT, it's so interesting because before ChatGPT, most people went to Dr. Google for advice.
Indeed. Well, this seems to be a step beyond Dr. Google, though Dr. Google, I think, has done more good than harm. It's easy to scare yourself if you're using Dr. Google there. You type in a symptom and you get not only all the terrible possibilities, but then you get everybody else's comment. Oh, my sister had that and she was dead in 3 months. And you wind up scared silly there. It's best to run it past your physician. But I don't get upset when people can ask me about, well, I read this on the internet. Wonderful. I'm glad people are learning more about it. And I think it's been generally useful. Um, but along comes ChatGPT, this remarkable entity that has this vast pool of knowledge behind it. And a lot of it is medical. And it's hard to well, there's no question that artificial intelligence, AI, is going to revolutionize the practice of medicine. When we can talk about it, and a lot of it is really exciting. Now, some of it's a little risky that we'll talk about. There are some hazards built into it. But I was amazed how I don't know, I dare say it, pro-vegan it was, ChatGPT, when I typed in, how does a vegan diet reverse atherosclerosis? Um, there wasn't a hint of negative, oh, here's 6 ways, and what we could talk about them. Here are 6 possible mechanisms, and 100% constructive. There wasn't the slightest negativity. This is a radical, unproven, not a hint of that. You asked it a straight question, gave you a straight answer. And I was pleased about that. And well, we can talk about the fine tuning about whether it hit all the points. And then I asked, how does vegan diet reverse type 2 diabetes? There's 7 ways, there's 7 mechanisms. And then finally, I asked it, how does it reverse autoimmune disease? And zoop, yeah, wow, very impressive. There's some fine tuning that we can talk about, but certainly not an adversary in any way. I think it's going to be a very useful tool, especially for folks in the plant-based world. Dr. Burns, have you had any experience with it? What's your take on AI so far?
First of all, just that these responses from ChatGPT on the topic of dietary disease reversal were really astounding. We'll get into them, but these were responses that most of our colleagues in medicine who were trained conventionally would not be able to come up with. I mean, we're talking about, you asked, how does a whole food plant-based diet work on atherosclerosis? And it was responding with points about endothelial function. I mean, this is some advanced physiology that most of us just never learned. Like, the only reason I was aware of those themes is from working with you and being in this lifestyle medicine movement. So it's really, I mean, it was really astounding. I will say, I mean, are you finding with your patients that they're on ChatGPT themselves? Have they done some research before they come to you?
Not ChatGPT per se, but only because it's so new, and so many of the patients you and I deal with, the answer is going to be eat a whole food plant-based diet. And don't worry about the mechanisms. Just do that and get yourself healthy. And but those who have an interest in, well, why does this work? How can I fine tune this? I'm sure I wouldn't hesitate in the office or during the telemedicine interview to pull up ChatGPT, ask it the patient's question, and share the answer. And I think that's going to be one of the greatest benefits of ChatGPT. It's never going to replace a human physician, and we can talk about why and the downside of AI in medical practice. But as a wise professor standing behind you, whispering in your ear, this patient mentioned they just traveled to South America, then you better include this, and this in your list of possibilities for diagnosis. And you better order these tests. That's boy, who wouldn't want that as a physician? So, because you hate to have the patient leave the office and, oh, I didn't ask him about other medications they were taking or family history of allergies. Well, the ChatGPT will remind you to do that. And so I think it's going to really augment the power of the clinical practitioner there. So we're going to see more and more of it. And there's a couple it's going to benefit both primary care doctors and the specialists. For primary care doctors, I mentioned it's going to increase the power of the questions when we're dealing with possible diagnoses and what test to order. Where they're talking about precision medicine these days, and that's a new term that we got to deal with. And what it really means is because people vary by their weight, their sex, their past history, their racial differences. Well, their diseases are going to manifest different, and their treatments are going to be different. You've got to tailor your testing and your treatments for that. Uh, and um, and that's where one of the hazards can come in, as far as if there may be bias built in to the algorithm. If all the test data and the normal values were all derived off of a population of white men, than if you have a diminutive Asian woman in front of you. Her values are not going to be the same. You got to tailor the. You hope the algorithm is understanding enough to overcome these biases there, and that's one possible hazard there. But it's certainly going to help the primary care doctor with follow-up, how to remind the patient you need to be seen, to do follow-up testing, etc. And nowadays, with all these wearable devices, the rings and the wrist device, etc., if that goes right into the AI program, so when the doctor tunes in the patient, they can see right away, here's what they've been running for blood pressure and heart rate and blood sugars for the last interval of time there. So it's certainly going to help primary care medicine. And the specialist is going to help the radiologist read MRI scans better and CT scans better. The pathologist looking at slides of tumor tissue, et cetera. The AI is going to be probably more precise in picking up very subtle diagnoses. And the dermatologists, I think, are going to welcome the AI's help in diagnosing, especially with telemedicine. The patient holds up their rash or a skin lesion. AI can probably do a really good job at diagnosing that. So it's definitely going to be changing medicine without question. But there's some hazards built in as well. Privacy concerns are an issue as your data gets slung back and forth between various from the insurance companies to the to other doctors. There's got to be concerns about that. And the last thing is uh, we got to be careful with the patients, not to gamify their health situation. If your goal is to keep that blood sugar level, if that becomes your goal there, then and all you're eating is saturated fatty foods all day. Yeah, you keep your blood sugar nice and level, but you're not going to be helping your health with that. And so there's an element of gamification that can sneak in that people need to be aware of there. But by and large, I'm really looking forward to it. And getting back to our topic of the day, I think the plant-based physicians are going to learn a lot, and I look forward to the AI being shaped for vegan patients and vegan doctors as far as the algorithms, specific things to be looking for and reminding the patients about.
There are a
Uh,
couple there are a couple of neat applications that
yeah.
my co-residents have already used and they
Oh,
told me about. I'm a little bit low tech. And by the way, this theme of ChatGPT was Dr. Klaper's idea, even though he was born a few years before me. But I don't personally have ChatGPT or utilize it in my practice, but uh, some of my co-residents will use it for the following way. So, one of them a patient asked about meal planning. How can I have more nutrient dense meals? Do you know anyone who could, like provide a meal plan? Well, yeah, you can find some through PCRM, um, through Forks Over Knives. Like these things exist. But what she did is she just said, all right, plant-based meal plan for 2 weeks, all different meals. And she even put in some specific parameters, and it just, within seconds, ChatGPT pumped out a specific meal plan that she could just print out and give to the patient without, it might have taken some time to get in to see the dietitian, et cetera. That's a neat one. Another one that my friends have used is in patient-friendly sort of medical communication. So say you have a lab abnormality and it's um, a little bit obscure, like it's not something we talk about, say that, I don't know, the mean corpuscular volume was a little bit abnormal and you want to communicate that in a way that's intelligible when you're not trained in medicine. Well, they did that. So, okay, take this CBC and explain it in lay terms for the patient. They just send that via the portal. It's a really efficient use of it, but it raises some, you really have to read through that. Like you don't just launch a paragraph explanation of the lab without really making sure that that's accurate, these are potential downfalls of using AI, because and remember, it's not we have not achieved this artificial general intelligence at this point. And so all the information that it's pulling from is just human information that's on the internet. Like there's nothing else. And so things to keep in mind.
Do you think a lot of people are using it? Because I mean, I don't have it. Like I've used it, for example, when people have asked me to write reviews for their books and, to just try to make what I want to say better. But I don't even know how to get it. Like I don't have it on my phone or my computer. My husband bought something, but do you think the average person has it and is using it for medical advice?
oh yeah, just go to Google and type in
Oh
ChatGPT
my
and the
gosh.
link will show and just click on it. And it's very user friendly. It says, "How can I help you?" Type in it has a little search bar, type your question in, speaks fluent English. You can talk to it conversationally. And within seconds, it spins out these very detailed answers that were it knocked me back when I first saw it, how complete it was.
But
Uh,
do most patients use it for medical advice? Maybe not. I mean, it depends on the population. So I work at a community health center where people are low income and they don't have as much technological resource or understanding. And so, no, they're not using ChatGPT. They're not even doing the Dr. Google thing, but I've worked in other places where, sometimes the population is referred to as the worried well, and they've spent a long time on the internet, and they've also talked to their like 4 or 5 physician family members, and they come to you with really specific questions. And that can be good. It can also be detrimental because they're not. It can breed a lot of anxiety when you're getting medical advice outside the medical exam room. But I think increasingly people will use ChatGPT for this sort of thing.
Absolutely. But again, another risk is that physicians get lazy and they just they don't read the answer thoroughly. They just send it off to the patient. And as we all know, these AI programs can hallucinate. They can confabulate answers that don't make any sense. And so again, it's got to be proofread by a real live human. And there's also a liability question. What if if the ChatGPT makes a mistake in the dosage or the strength of medicine? Who's at fault here? Who gets sued? Who covers that mistake there? The designers of the algorithm, the doctor who used it. This is new frontier stuff. Um, but uh, but again, we're at the beginning. There's no stopping this. There's no putting the genie back in the bottle here. This is going to permeate all of medicine without question. But
Liability
yeah,
liability also comes up when you're using images. So say you scan a skin lesion, and you want AI, some kind of AI program, to scour the internet and find all of the lesions that have similar characteristics. We wouldn't be able to identify it in that detail. So it can be a powerful tool, but what if that program gets it wrong? I mean, who's at fault there? At this point, we really have to be using common sense. There's really no substitute for that. Same thing in radiology. They say that radiologists might be the first specialist to become obsolete. We love our radiologist colleagues, but these programs can look at a scan with such detail that I think that AI will become really integral. It probably is already being utilized in that field.
yes. Go ahead.
No, I was going to
Yeah.
say, wow, I don't know if Dr. Peter Rogers, whose show is tomorrow, I don't think he'd like to hear that very much.
Or Dr. Barnett. We'll have to ask them how they feel
Right.
about it.
Indeed, how's they're feeling about it. It should just augment their abilities there. You just can't replace them. And the human physician, somebody's got to take responsibility for saying, yes, that scan is the way I would read it as well. But the AI eye is probably a bit sharper than the radiologist, but still the interpretation is what matters. And the patient's whole history. When did this appear? It's more than just a spot on a film. It's who is this person and what do they do for work? What kind of air have they been breathing? And if it's a chest X-ray or a chest scan or whatever, the human radiologist needs to, was what they do. They're a very underappreciated specialty, but they've got to be clinicians as well, and as they make that diagnosis. And so the AI, it's a tool, it's a powerful one, but it's still not going to replace human physicians. But another risk, of course, is that, and it's happening today with the electronic medical records, where you come into you come for a doctor's appointment, you sit down, and there's a doctor typing into a computer screen, and barely even looks over at you as they're supposedly listening, but they're just typing and typing away, and the personal interaction between the doctor and the patient gets lost. And that's a real hazard there. That's we can't lose that primordial relationship of the physician and the patient. So it's,
Arguably AI could alleviate that because it's listening. Say the AI ear is listening and it can do some of your charting for you. It could be a scribe. It can populate some of your note, right? And then it frees you up to actually have more human interaction with the patient. I don't know why I'm um, advocating for this thing. I am skeptical in a lot of ways, but it has some interesting applications that way.
yes, I was just listening to a Rich Roll podcast. He had the head of Stanford Medical School talking about AI. And that word came up a couple times. Be skeptical. So whatever that AI tells you, have a little lens of skepticism. Well, maybe, okay, interesting, but not the final word there. It still resides with the physician. And a little skepticism is important in accepting the conclusions. But getting back to the context of our talk today, this is a plant-based discussion. I just for the fun of it, after I got these answers, and by the way, the answers that the ChatGPT gave me on how does a whole food plant-based diet improve type 2 diabetes. Absolutely. Weight loss, improve insulin sensitivity, reduced inflammation, gut microbiome health, nutrient density, improve glycemic control. Fair enough. Those are all valid mechanisms. Not a word here about intracellular lipid or the uh, the changes that happen as you pull the fat out of the diet, how that fat is metabolized, et cetera. It didn't drill down, in great detail, though if I asked a follow-up question, it might have done that. The same thing I asked, how does a whole food plant-based diet reverse atherosclerosis? Lovely answers: improvement in blood pressure, anti-inflammatory effects, enhanced endothelial function. Didn't mention improved the blood viscosity goes down. The blood is more free flowing. Didn't touch on that at all because of the higher water content of the foods. It didn't hit all the bases, but it got the right sense of it. Um, and so just for the fun of it, I said, how can we get the public to see vegan diets as positive for health and the planet? And boy, didn't hesitate. Promoting the benefits of vegan diets for health and the planet requires a multifaceted approach that addresses both the practical concerns and misconceptions. Here are some strategies. And spit out education, environmental awareness, culinary innovation, celebrity endorsements, policy support, community building, marketing strategy, collaboration, lead by example. And at the end, it said, by employing a combination of these strategies, we can help shift public perceptions of vegan diets from being seen as restricted or extreme to being recognized as positive choices for both personal health and the health of the planet. Well, good for you, ChatGPT. I was gratified to see that. And so I would hope that people, our viewers here, start using this to enhance their own personal efforts, whatever, if they're helping the animals or the planet or health, whatever. Use this as a spectacular tool, and it's free for the asking. It's free for the Googling, and the classic ChatGPT is free. They now have GPT-4, which costs you a few bucks a month. But the basic ChatGPT is free for the using. So new era has dawned here.
Dr.
So,
Klaper, have you ever asked ChatGPT what's the best way to lose weight?
No, I haven't. But why don't we just do that right now,
I
just for
would
the fun
love
of it
to
here?
know the
All
answer.
right, fair enough. So, and should I ask you utilizing a whole food plant-based diet or just weight?
Maybe see what it has to say in general first, and
All
then
right,
maybe
fair enough.
ask.
All right, what is the best way to lose weight? Okay, and it says with a 3-second delay there. Best way to lose weight can vary depending on individual factors such as age, gender, current weight, health status, lifestyle preferences. However, some general principles can guide, and nothing revolutionary here. I'll wait till it's finished spitting out. One is healthy eating habits, focusing on a balanced diet, plenty of fruits, vegetables, lean proteins, whole grains, limit processed food, sugary beverages, high-calorie snacks. Portion control is also essential, not really on a whole food plant-based diet, as consuming more calories than your body needs can lead to weight gain. Regular physical activity, behavioral changes, pay attention to your eating habits and behaviors, lifestyle modifications, get enough sleep, manage stress, avoid unhealthy habits like alcohol, cigarettes, seek professional guidance, work with a registered dietitian, nutritionist, or healthcare provider who can provide personalized recommendations and support. Stay consistent and patient. Weight loss takes time. It's essential to be patient and persistent. Focus on making small, sustainable changes to your lifestyle rather than seeking quick fixes or extreme measures. Celebrate your progress along the way. Be kind to yourself as you experience setbacks. The last sentence, ultimately, the best approach to weight loss is one that fits your individual needs, preferences, and circumstances. It's essential to prioritize overall health and well-being rather than solely focusing on the number on the scale.
Some good
So,
points, but perhaps slightly generic, right? And they didn't even
yeah,
say watch Chef AJ's show or read her book.
right. Now, how best to lose weight utilizing um, a whole food plant-based diet, and see if that changes the answer at all. Okay, focus on whole foods, eat plenty of fruits and vegetables, incorporate whole grains, include protein-rich plant foods, healthy fats in moderation, limit processed foods, stay hydrated, be mindful of portion size, plan and prepare meals, stay active. Yep, standard stuff, but it is what it is. Uh,
On
I
the
Go ahead.
on the topic of lean proteins, right? When we ask this, generally, how does one lose weight? Best, the first question. They talk about lean proteins, which seems to be the convention in mainstream medicine. If anyone wants a little more perspective on lean animal proteins, our last episode was on the some issues surrounding chicken and fish. So just to point to that, so that was our last episode, because it's really it's a problem because doctors are routinely recommending basically white meat, chicken. It's generally considered wise to reduce red meat, but people are saying eat as much chicken, turkey, and fish as you want, and it's really an insidious problem with our recommendation. So something everyone should know. And then one thing that it did talk about sleep, one of the last two questions, and I think that's really great. I actually noticed on the original questions about a whole food plant-based to prevent atherosclerosis or type 2 diabetes, it didn't mention sleep. But here's the thing, when you're eating a clean diet, you're going to sleep better. The quality and the duration can improve. And that's really key. A study just came out in JAMA about sleep to reduce type 2 diabetes risk. It was a massive prospective cohort study where people, they basically, if you're getting 4 or 5 hours of sleep, your risk of developing type 2 diabetes increase proportionally, to how little you sleep. And then they looked at diet, and of course, they found like the healthier categories of diet were associated with the reduced risk of diabetes. But they found that there was no additive effect between sleep and nutrition in decreasing diabetes risk. Okay, but the optimal diet in this particular study included fish. And so one wonders, if it was a more exclusively plant-based diet, could that have an additive effect with sleep on reducing the incidence of diabetes? Because we see those kind of trends in other studies like Adventist Health Study 2 and such.
Hmm. Hmm. Is there a question for me in that? I think the points you're raising are just excellent, and the specter of the chicken and fish being healthy is still stalking the land, and people really fall into that. And well, how about just a little fish? How little? Guppies, minnows. What kind of little fish are you talking about there? And but we're clear cutting the oceans. We're strip mining the oceans at this point. You can't ignore if we don't have a healthy planet, a healthy ecosystem, it doesn't matter what your weight or your cholesterol levels are, and that needs to be incorporated into our advice as well. It's not worth a little fish is okay, not anymore.
So agreed. And you mentioned what was on my mind, the intramyocellular lipids.
Right.
So ChatGPT didn't get that far, but that's a really key part of the pathophysiology of insulin resistance in type 2 diabetes. Could you elaborate on what that is?
Yes, when people are eating a high-fat diet, and despite most protestations, oh, I don't eat, hardly eat any XYZ. Most folks, especially if they're eating the standard Western diet, the bacon and eggs for breakfast, the cheeseburgers for lunch, the chicken for dinner, the ice cream for dessert, you're keeping your blood fatty hour after hour. And as the weeks and the months go by, that fat starts oozing into your muscle cells and into your liver cells. It starts accumulating there. You can see it under the microscope. You see these black blobs in the cells there that does not belong there. This is fat in the muscle cells and in the liver cells. And they inhibit the enzymes that run the mechanism that when we eat sugars, and the pancreas puts out insulin. The insulin molecule plugs into the receptor on the surface of the muscle cells and the liver cells. And normally that activates enzymes that pulls the glucose, the sugar into the cell where it can be burned. But if those enzymes are all gummed up with the fat, with the intramyocellular lipid, a big 50-cent word there, but intra is inside, myo is muscle, cellular is in the cell, and lipid is fat. So this is fat in the muscle cell. If those enzymes are all gummed up and inhibited by the fat in the muscle cells and the liver cells, insulin molecule attaches to the surface of the cell to set off the enzyme mechanism, but nobody answers the call there. The enzymes are too gummed up to respond. So the sugar piles up in the blood, and people are walking around with high blood sugars, which has its own problem. But when people say, "Ooh, diabetes, oh, sugar, sugar," don't the problem is too much sugar. No, the sugars the high sugars are the tail of the dog. The key is the fat that you're eating on a daily basis that's clogging you up. And so that's why that rolls off our tongues now. A low fat, whole food, plant-based diet. That low fat is important for this very reason. Again, is the fat driving the insulin resistance.
And so once you have that insulin resistance, you can't get the dietary glucose into the cells. So if you have a high sugar, processed sugars, right? Soda, cakes, cookies, ice cream, that's just going to exacerbate the problem and you'll have hyperglycemia. But the important piece is that that was not really the origin of the problem. It was the standard Western high fat diet that, as you say, clogged up the insulin receptors such that they cannot do their job and bring that glucose into the cells where they need it, where you could metabolize it and have a proper glycemic response. Now, the other thing is that you mentioned the liver cells get clogged up as well. And when that happens, the sugar can't get inside those hepatocytes, the liver cells, and they perceive that they don't have enough sugar. So the response is that they promote gluconeogenesis, so making sugar from scratch. And that so then you're pumping out more glucose into the body. It further exacerbates your high blood sugar. and the problem spirals.
Yes, one of the main actions of insulin, it tells the liver, stop putting more sugar into the blood. It puts the brakes on the liver's production of sugar. And if you, again, if the liver is all clogged up with fat, it keeps pumping out the sugar. And the poor pancreas has to put out more insulin to try and keep up. And after a while, it exhausts the beta cells in the pancreas that are putting out the insulin, and the whole thing spirals into official diabetes there. And you know, a million years ago, our ancient foraging ancestors spent all day foraging for food. Calories were of prime importance. They were mostly carbohydrates. They would dig up starchy roots and tubers. They would harvest edible grasses and berries, etc. Fats were relative rarity in the native diet there. If you came upon nuts or avocados, or their ancient progenitors of avocados, and of course, the animal fat, but even the animals back then were lean creatures, the antelope and whatever, wasn't much fat on them either. So fat was a real premium in ancient times, and we were naturally running on low-fat diets. Well, catapult us into the 21st century. Now fat is everywhere, and when you can, from the egg yolks to the ice cream, you can eat fat all day, and it starts piling up in our tissues. And it's a real artifact of our modern life that we've created this insulin resistance. Our ancient ancestors never had to deal with that. But again, we indulging in these fatty foods tastes great on the tongue, but boy, it sure causes a lot of mischief once they get into our cells.
On that subject, how does fat promote in a low-fat diet reverse atherosclerosis?
Right. Well, I'll get to that in a second. But as far as reversing diabetes, once you pull out the fats, once the only fats you're getting are from whole foods, not out of glass bottles or pouring olive oil on which will make the problem worse. But if the fats you're getting are from a few walnuts and some flax seeds on your cereal, and some hemp seed, that's about it. It's a low-fat diet. If your cells were already loaded up with that intramyocellular lipid, suddenly that steady flow of fat coming into the cells is gone, and the cells in your liver and your muscle, hey man, we need to, what are we going to do for energy? They look at, hey, we got this fat's already in our cells, let's burn that. And that's what happens. The intramyocellular lipid gets burned for energy. And when that happens, that opens up the insulin receptors. And suddenly you get normal blood sugars, and we're back to our ancient physiology where a little bit of glucose is easily dealt with and doesn't cause problems with high blood sugars, etc. So it's a reversible disease. That's when we talk about reversing diabetes, we're talking about burning out that intramyocellular lipid and opening up the insulin receptors. And yay, the insulin resistance goes away. Yay. And now with the atherosclerotic plaques built up in the arteries there, a similar phenomenon. These plaques are full of oxidized cholesterol, and the inflammatory cells that having those oxidized cholesterol particles in the artery wall sets off an inflammatory reaction, and that's largely what those plaques are. Well, when you stop the oxidized cholesterol, most of which is from cooking animal muscle, the very act of grilling the burger and broiling the steak and frying the chicken oxidizes the cholesterol in the animal's muscle. And so every time they eat that chicken breast or that burger, the flood of these oxidized cholesterol particles flood through the tissues, and they work their way into the walls of the arteries and set off the plaque formation. Well, when you take that away, stop doing that. You're eating rice and beans and greens. Steaming broccoli doesn't create oxidized cholesterol. Boiling rice doesn't create oxidized cholesterol. It's a gentle diet as far as the arteries go, and when that happens, you stop making the problem worse with every meal. And you're eating lots of colorful fruits and vegetables. All the lovely salads and steamed veggies are full of antioxidants that, as the time goes by, seep into the walls of the arteries. They neutralize the free radicals. They damp down the inflammation. And the plaque cholesterol starts getting absorbed, and you can see the plaques getting regressing. They get smaller and smaller. Arteries heal, and sprained ankles heal, cut skin heals, inflamed arteries heal. If you stop injuring them, the body knows how to do that. And it's a remarkably reversible disease, unlike the cardiologist's common belief. Once they get that angina, they are all going to need stents, they're all going to need bypasses. That's right, doctor. If you don't talk to them about changing their diet, that's what you're going to see. But it doesn't have to be that way. It's a reversible disease that we really need to get that message out to our colleagues as well as to the general public. We are plant-eating hominids. We need to honor that. Gorillas in the wild do not develop atherosclerosis. They're eating a high-carb diet all day, all the leaves and fruits and vegetation, and they don't develop clogged arteries. Duh, there's a message there for us. Never seen seeing a gorilla eating a cheeseburger there, and that's probably why they don't develop the diseases.
So yesterday I was covering in the hospital. This month in residency, I'm working outpatient, but I was covering for a friend. And a patient comes in, we get a message, admit this patient, 70-ish year old, with chest pain. And it turns out the patient had a stroke 7 years ago. He fortunately didn't have any residual deficits. But after that, he had a workup to check his carotid arteries. Found the left side was quite clogged. He had a carotid endarterectomy. It's honestly, an incredible but high risk procedure to dig the plaque out of his carotid artery. You have to cut off circulation to half your brain for a minute. During that procedure, the patient has an EEG they're measuring the brain function to make sure that the lights don't go out. This is really high stakes, consequential stuff. And of course, he didn't have any particular genetic predisposition. These were the predictable consequences of a Western diet over the years and decades. And so he had this stroke. He had the carotid endarterectomy. I asked him, did your primary care doc, did your cardiologist, did they talk to you about nutrition or kind of what you should be eating at home? He said, well, not really.
Why would they do a silly thing like that? Go ahead. Sorry.
Yeah, no problem. Yeah, he said, well, yeah, they put me on a bunch of medications, but we didn't really talk about that stuff. Referring to nutrition. So it's interesting because you'd be really a great candidate to make some sustainable lifestyle changes before this got worse. And unfortunately it did. So he came to us yesterday. He was having angina. So if he walked a certain distance, his chest started to hurt. And he was already scheduled. It was a slower onset, and he'd been to the cardiologist. He was already scheduled to have the cath, where they go in through, they look at your coronary vasculature, the blood that supplies the heart itself, to see if there's a blockage that's amenable to a stent, right? And he was due to have that, but they said if your pain comes back, come in sooner. So now they'll probably expedite his cath, and it's just, there's a portion of people who go in for this procedure and have a really bad outcome. They're in your coronary system and they're kind of wiggling around with the plaque. You can flake off a piece of plaque, and if it goes the wrong direction, if it basically occludes one of the major coronary arteries, you induce ischemia, and people sometimes can die during that procedure. It's a huge deal, and we really have an obligation to talk to these guys about extremely low risk and like sort of fundamental changes that they can make beyond the meds and surgeries. But on the bright side, the same hospital, right? We went around because we're working on improving the dining options, making them healthier. We went around and talked to people about their preferences. And while not everyone had tried the plant-based options on the menu, or not everyone was well versed in these things at home, like right? It's a, it's a population that is kind of meat and potatoes, many of our patients there. But at the same time, they were very receptive to, we would ask, like, if there was a healthier version of the burger or the bacon or the sausage, some of these healthy whole food options on the menu, would you be interested in trying them? And the vast majority said, yeah, of course. And some people who had tried the vegetarian options on the menu, and some are vegan actually, they said, yeah, it was actually delicious. We said, would you try that at home? Would you continue, eating that sort of style? They said, yeah. So it reminded me, you never count out a patient because of their age or their background, or what these assumptions we make about what people are willing to do. We have to give everyone the chance of proper counseling on lifestyle, and just assume that people want to do what's best for their bodies, because most of them do.
Froze
So.
up there.
He froze up for a minute.
Oh, well, that's, yeah, just not to count out the capacity of a patient to change their lifestyle. So
Oh,
just wanted to
Zach,
share that.
Dr. Burns, there is so much in that story. You encapsulated the entire, what's wrong with Western medicine is in that story. I'm well familiar with carotid endarterectomies. When I used to do anesthesia, we've did quite a number of those procedures. And when the surgeon clamps off the carotid artery so they can remove the plaque, I don't know, we watch the patient's blood pressure. But the anesthetist's blood pressure goes up, I'll tell you, and my adrenal gland's going to work out until they release that clamp. It's as scary as you're shutting off blood flow to the brain. And so you put the patient at great risk, and you pull the plaque out. But what have you done? You've pulled one piece of plaque out of an important artery. But as you've implied, it's a total body disease. If you've got plaque in your carotid arteries, you've got it in your coronary arteries, as this man obviously had when his angina appeared, but you've got it in your renal arteries to your kidneys, you've got it in the femoral arteries going down to your legs. It's a total body disease. And this plaque's got to be melted away from the entire blood vessel system day by day with a whole food plant-based diet. And yet the doctors are just homed in. Well, we put in a stent and we removed a plaque, the patient's cured. No, doctor, the patient's not cured. And in fact, those arteries will continue to get worse if the patient doesn't change their diet. And so they're so focused in on this, the one little procedure, they're missing the forest for the trees there. But on the good part, the fact that you've got vegetarian options on a hospital menu, that never used to happen. That is music to my ears. How did that happen? Did you have anything to do with that? I'm curious, but the fact that it's there is a very positive sign. And I hope that so some of them are even vegan options. There's a saying when the dog plays the violin, don't criticize the quality of the playing. The fact that he's playing it at all is amazing. Yeah, and the fact that they've got a vegan option on the hospital menu is earth-shaking, is wonderful. So I hope the dietitians are on board with that and promoting it, and I hope it's being taught to the patients. So as you said, when they go home, they continue a healthy plant-based diet. That's great news in that.
Yeah, we have several vegan options now on the menu, and it just takes some nudging and persistence. I mean, what you say is that the current menu is not compatible with the nutritional literature, and doctors don't feel good about their patients having these options, right? It just doesn't feel like appropriate medicine. So that's the message that our dining task force has been pushing for since I've been in residency. And the dining team is quite receptive. That, you know, they are somewhat wary of patient satisfaction. They have certain incentives to, you know, they don't want to alienate the patient, say you can't have anything. But we've made a lot of changes, and the patients are into it. It's just going to be more education for providers and patients on what these, like, you know, what the options are and why they're important. But
as far, you know, our organization, Moving Medicine Forward, we're trying to get that message into the heads of the young, the medical students and the young docs and the residents like you about plant-based nutrition can reverse these diseases. I detect a little glimmer of that, the fact that the hospital menu has these plant-based options. Have you been talking to your fellow residents and the medical students? Are you sensing a more openness to plant-based nutrition in general, or nutrition in general having any effect on these diseases, but plant-based nutrition in particular? Is it a topic that your colleagues are conversant with on it, on any level?
yeah, I have to say in my program, I'm perhaps the most passionate about this topic, but there are a lot of people who share an interest, especially in lifestyle medicine more broadly. And, you know, at Brown, at the medical school here, there's one of those lifestyle medicine interest groups. And that's one of over 150 of these LMIGs across the country, where they're taking time out of a busy med student schedule to learn about lifestyle medicine, because they've realized that it is the only way that we have a chance at tackling chronic disease. The third year students go on the wards and they see that pretty much, you know, at least 8 out of 10 patients on a given hospital hallway are there because of what they've been eating or sometimes drinking or smoking. I mean, it's not just about the new sexy, you know, biologic medication or, you know, advanced procedure. It's it's about the basics. So people are getting that, and I think there's a lot of enthusiasm. And then there's also the ACLM's residency curriculum that they're building into residency programs, and I think there are over 300 of residency programs that have incorporated that. It's a really good sign that residents are hungry for this information so they can really do well by their patients.
Oh, that's really great news to hear. AJ, we've used up a good chunk of the hour here. I don't want to step on your time
No,
constraints.
I love that you guys are having a conversation. I will say this is not on the subject of ChatGPT, but occasionally viewers, knowing that you're going to be on, send in a question specifically for both of you. So if you wouldn't mind answering it, it would be
Sure.
wonderful. This is from Joanne. She says, I have a question for Dr. Klaper and Dr. Burns. My brother is 75 and has steadily worsening vertigo that is getting serious enough that he's worried about being able to live independently. It's worse going from sitting to standing or bending over. He's seen his GP, has had every conceivable blood test and 2 MRIs, but nothing was found to explain it. He did have severe vertigo when he had COVID previously. Despite my urging, he eats standard food and won't even consider whole food plant-based. I've researched vertigo and there isn't much information online. Any suggested? Greatly appreciated. Maybe we could ask ChatGPT.
Whoa, I will do that, but I certainly have some thoughts about that. Dr. Burns, you want to have the first shot at it, and I'll follow up on that while I'm talking to GPT here.
Sure. Yeah. The important thing is that two important things. One is that, you know, without knowing all the details of the case, we can't really recommend anything in particular, but we can give some general advice. And the second thing is, I'm glad, you know, that he had an MRI. Basically, what that does is it rules out any actual mass or space occupying lesion in the brain itself that could cause these symptoms. And it sounds like the MRI was clean, and that's really important. With vertigo, if you really have to characterize it, sometimes it seems like vertigo, but it's something, it's a different kind of dizziness. If it is vertigo, the most common type is benign positional vertigo. And that's, so a question for him would be, if he moves from sitting to standing, or if he turns his head, does it trigger the symptoms? And for that, there are different things we do. There's some physical maneuvers that your doctor can help you with that basically resets the inner ear. And then there's an antihistamine, meclizine, is something that we commonly use for that type of vertigo, but we'd really need a bit more information.
Agreed. The most common cause, as Dr. Burns said, we have little crystals in our ear balance mechanism that can break loose, and as the person changes position, these little broken off crystals rattle around in the balance mechanism and send all messages to the brain that the world is spinning around there. There are maneuvers, the Epley maneuvers and others, that can help reposition these little crystals. If you go on YouTube and type in home maneuvers for positional vertigo, there's an ear, nose, and throat physician, a lady doctor, who gives you how to do this, sitting in a chair, bend forward, turn your head, and hold that position, and get down on your knees. There's a way, and you're repositioning these crystals there. So check out the YouTube's maneuvers that he can do on his own on benign positional vertigo. But also, we're talking about nutrition. The balance mechanism in the inner ear is fed by the cochlear artery, which is a tiny, tiny little artery. And if there's any plaque in that artery, if his cochlea and balance mechanism, the utricles there, are short of blood flow, that can certainly do this as well. And again, surprise, surprise, we were talking about opening up arteries with a whole food plant-based diet. Well, that's one artery you want to open up, the cochlear artery. So I don't know how amenable he is to changing his diet, and you can't make any promises. Just eat rice and beans and tofu, and your BPV will go away magically. But it's a factor. You should certainly take care of his arteries with a whole food plant-based diet, and check out these videos about repositioning the crystals in the utricle there, and hopefully he'll get some relief.
Another piece is that some people with vertigo or even other vague symptoms like this, you got to look at their medication list, because as we know, people who are eating a standard diet and worked up in the standard way are often on a dozen or more medications, and even one alone, especially the interactions between the meds, can precipitate these kinds of just dizzy. How many people are over-treated with their antihypertensives and their SGLT2 inhibitors? They're lowering the blood pressure and stacking that effect. And so is it that he gets up and feels lightheaded and he's calling it vertigo? You want someone to really analyze the medication list to make sure we're not doing this with our potions and pills.
Well said. We docs can do that on a regular basis. Polypharmacy is a risk. Go ahead, AJ.
What I was going to say, what I find interesting about what's two things about this question. One said, well, he's not interested in changing his diet, which I always find it's interesting when some people say, even if it will help, I'm not interested. So they want something else. But, I've been doing this show. I'm almost at episode 2000 now, and most of the guests have been doctors. And so many of the questions that come in is, will whole food plant-based help this? And then so I keep thinking, even the people will have, not everything, will be helped by whole food plant-based. You fall down, you get hit by a truck. No, the diet will help you heal. But I find it curious that some people will only change if their particular disease will be helped. There's all these other diseases we know for sure will be reversed or prevented. But if this particular one had been, I'll keep eating steak. You know what I mean?
Homo sapiens, strange species. Help is right in front of them on their dinner plates, and that's the one thing they don't want to change. And so, thanks. I'll take my disease. Thank you. Pass the steak. we're a strange species. I haven't had any gorillas in the office saying, I can't keep my hands off the cheeseburgers. They know what to eat. We have to yet to learn the lesson.
I heard a story once of a like it was an animal that was used in for a guy to make money. It was a primate, and he basically fed him McDonald's, and this primate got atherosclerotic disease
They
from
certainly do.
yeah.
Gorillas in the wild do not develop clogged arteries, but that's what kills the gorillas in the zoos is they absolutely develop atherosclerosis and they have heart attacks and strokes from the meat and the cheese and whatever else is in their gorilla mix, gorilla food mix there. Absolutely. Boy, there's a lesson. Everything you need to know is right in that anecdote.
Well,
And
my friend Dr. Musial says there are 3 species that can become overweight.
I know what
Did
they
you
are.
know- You got it? Go
Humans
ahead.
and their domesticated dogs and their domesticated cats. Because
Right.
not
And
eating the diet.
literally no other
gold star.
species will will do that because they're not eating processed food.
Yeah.
Absolutely.
That's the only 3 species that really do eat processed food. Yeah.
Really, never seen an obese giraffe, never seen an obese antelope, right?
My God. I fed a giraffe once, and boy, their tongues are like, I mean, that's crazy. Yeah, it's just well, you've been I love your combination because like Dr. Klaper, you've been doing this longer than just about any other plant-based doctor, and you're kind of new, Dr. Burns. Not necessarily, but you're kind of new being a doctor and you're new being plant-based, but you both have like such similar passions.
Mhm.
We're a good team.
Yes, we're a team, three of us here. It's a
Clapper
great.
and Burns, it could be
All
a
right,
comedy act. Oh.
take it on the road. We're
That's
opening in Peoria next week. Um, but um, but it's great that you offer this platform to get this information out to your viewers, and so you're an integral part of the team here. So
well,
thank you for
thank you.
that.
We hope that people will take, I can give the message, but they got it. I don't know, I think this is just me. I'm not a doctor, but food addiction is underdiagnosed and I mean, a lot of the doctors on this show don't believe in it because if that wasn't a thing, why wouldn't people change? Why, with all the evidence, well, I can never give up my cheeseburgers or whatever. What other mechanism could there be for people to rather die than switch?
Yeah, I was skeptical because, if I don't eat, a particular food, I can't say I go through withdrawal symptoms. And so I was skeptical about it. But then the more I read the neurophysiology literature, and I see these functional MRI scans, where when you have someone with a real food issue and you put them in the MRI scanner and you show them a picture of the cheeseburger, the part of their brain lights up is the same one that the heroin addicts have when they look at their next drug fix. And and so I have to begrudgingly admit, yeah, I guess that's on a neurophysiologic level that qualifies as an addiction. The brain is responding the same way. And in that way, I can kind of understand the answer to your question. Well, why won't they give up their cheeseburger? Because that feeling of the initially lighting up that pleasure center is so powerful. And the taste of that cheeseburger does it. That's what they really start craving. And it's quite a challenge for both the person and their healthcare practitioner.
It's too bad people don't know that they could get to the other side because I've been to True North at the same time as both of you. And I mean, people think like we eat such an austere or draconian diet of like, yeah, I don't know, bean sprouts. The food's amazing that we eat, but they just haven't gotten to the point where it tastes good to them.
Really,
Right. I remember, the fear before I went fully plant-based, like, will this be such a big sacrifice in my quality of life? It sounds silly now. But that really held me back. But like for a couple of years after I knew that I should be vegan, it held me. I was like, without pizza and ice cream, is life worth living? It sounds absolutely ridiculous. But I think this is a real fear that people have before they realize how delicious plant-based lifestyle is. But I think behavior change is partly individual and partly social and sort of economic factors. I mean, why are people eating this way? Because of advertising, because of tradition. So like if as long as we have ads for junk and fast food bombarding us on TV and on social media, and as long as we have the billboards and the fast food restaurants on every block, it's, you know, it there's an individual aspect, but it's going to trigger those cravings because we're just inundated with messaging about eating the next animal protein hypercaloric product. So, you know, and it's so that I think we have to tackle it structurally as well. I was just looking um, at some of the major medical societies and who their biggest donors are. All right, they're usually the pharmaceutical companies and the device companies. This is the American Diabetes Association, the American College of Cardiology, okay, American Heart. So, you know, is it any wonder that the guidelines that are produced by these esteemed medical societies have a, you know, they're really talking about medications, and that's what they're focused on, right? And then it percolates into medical training, and that's what doctors focus on is drugs, and especially the latest and greatest. The American Cancer Society, one of their corporate sponsors is Outback Steakhouse, right? Hormel Foods, the maker of Spam, also contributes regularly to the American Cancer Society. So we need this contact. We have to understand the economics of healthcare, because chronic disease is an industry, all right? And so we can't let ourselves get taken advantage of like this, right? It is we have with this kind of program, and, you know, with education and having conversations, we can overcome the impact of our, you know, of like basically these corporate partnerships that influence healthcare the most.
I think that's a very valid point. Going back to the way the brain lights up with the cues for the food, the addictive food. I had a patient who had been a person who really had a strong addiction to various drugs, and but was now struggling with their weight. And he said, Dr. Klaper, if someone is really addicted to drugs, and you drive down the street and the signs in the windows and hanging down from the stores were heroin here and methamphetamine and cocaine, you know, that poor person would really be pulled and drawn by the temptation. But you have someone who, because their brain lights up with the very thought of that word there. But if someone's addicted to foods, you're driving down the road, what do you see? Burgers, pizza, chicken, you know, it's a similar phenomenon. And as you say, the society is really structured to keep that association going. And, you know, and parents, you know, they don't know. They feed their kids what their parents fed them. And you grow up eating these comfort foods, and the neural patterning gets set in early on. And then society, as you say, keeps it going every day, because a lot of people making a lot of money off both the food and the diseases they create. And the individual has to break through that and see the truth. You know, in the land of the blind, the one-eyed person is the king there. And open both your eyes and eat plants. That's what we're here to do.
I love it, guys. Thank you so much, both of you, for taking the time. I know you both very, very busy doctors on opposite parts of the world. How are things going in your new country, Dr. Klaper? Do you enjoy living?
Oh, I'm really excited about joining the staff. I'm joining the Aroga the Aroga Lifestyle Medicine Clinic up in Victoria, BC. And it's fascinating. And the main draw for me there is that in the United States, the insurance companies basically pay the doctors. You bill Blue Cross and Aetna, and you get whatever they pay you. But one thing that the insurance companies don't pay for are dietitians. The dietitian is held at arm's length and not really brought into the primary care treatment team. And because the insurance company is making money off of every stent and every bypass, there's no incentive for them to get their patients healthy. In Canada, the government is paying the shot for the healthcare, and they are interested in getting their people healthy. And so they pay for dietitians. They know the importance of healthy eating. And at the Aroga Clinic, the the flow of patients. The patient gets referred in by their GP. They see the physician at Aroga, and the very next stop that everybody has to go through is the plant-based dietitian. And he or she gives the patient a plant-based dietary program, and only then are they referred on to the physiotherapist, whatever. And then the patient is seen on a regular basis by both the primary care doctor and the dietitian every month. They come in, and if necessary, they're assigned a health coach. But they really they're very pro-plant-based eating there. And it's going to be so exciting. What I want to do is I'm the director of telemedicine services for them. So because a lot of the follow-up is done through telemedicine, I want to keep track of the people who go through this program and document their health improvements, their weight loss, their blood pressure, their medication. And when we get enough data, come back to start appearing at the American medical meetings at the AMA and the ACLM and various medical organizations saying this is what they're doing in Canada and it's working. Get the dietitian on the primary care team and you'll get your patients healthier through disease reversal, through plant-based nutrition. And I want to build the pressure up so there's no choice. They're going to have to change the reimbursement and start paying for dietitians and plant-based dietitians, not the ones spouting the usual meat and dairy line there. And I'm really excited about this new chapter that's opening up for me that I will hope bring back to the States to help the American system get on board in the 21st century. I'm just up in Victoria, just north of Seattle. It's not like I've gone to the moon. And I'm still doing our Moving Medicine Forward talks through Zoom and through live presentations. MMF is rolling on, and it's so great to have Dr. Burns on the team because he's doing great work where he is, and eventually we'll pass the torch officially to him. But right now, it's great teamwork that I'm really enjoying.
But you're used to living in the desert in Florida, in Hawaii. It's not too cold for you in Canada?
The Victoria's it's the banana belt of Canada. So it doesn't get terribly cold like Calgary or Toronto, but it's chilly. And my wife Elise, she's a warm weather girl, and she's being a good sport. She's really enjoying being in Victoria. It's a lovely small city with a symphony orchestra and film festivals, and it's a very pleasant place to live. And so she's being a real trooper, and we're both really enjoying the transition. So, and I promise if it gets really cold, we'll send her to Puerto Vallarta for a few weeks. We'll get her into warm weather if she wants to get out of the cold. So fair enough.
Nice. Where do you live, Dr. Burns, if I may ask?
Yeah, I'm in Providence, Rhode Island for residency. But when I graduate, I'm going to take a job in Rochester, New York. So I'm also venturing into the tundra. But, I'm excited because the winters have been so mild. I grew up in New England, and with climate, it's just lame these winters. So I could use some more snow, get out in the woods, go cross country skiing. I'm looking forward to that.
Are you going to be working like with Dr. Ted Barnett?
Not directly, but it's going to be great to be in his neighborhood.
That's great. Well, thank you. Oh.
It's interesting, by the way, mentioned Dr. Barnett. I asked him about working with Dr. Burns, et cetera. And he said, 10 years ago, absolutely. But he says, we're now global. It's not even localized into Rochester anymore. So many of our members and supporters live all over the world, literally, and all over America, that it doesn't matter where you live anymore. So it's less Rochester centric. And I think it's a very positive sign. So that's one reason why Dr. Burns will be in his own orbit there.
So, well, thank you both. It's always a pleasure talking to you. And thanks all of you for watching another episode of Chef AJ Live. If you'd like to support the work of Dr. Klaper and Dr. Burns, Moving Medicine Forward is a nonprofit 501c3. The link to donate is below. And please come back tomorrow for Dr. Peter Rogers. He is going to be talking about Western abdominal diseases. Take care, everyone.
Bye.